Let's talk about acidity today or heartburn. Now, is acidity and heartburn the same thing?
Namaskar. I am Dr. Vipul Roy Rathod. I am the Director of Gastro Oncology at Fortis Hospital Mulund in Mumbai. Today we will talk about some interesting topics on digestive health. Let's talk about acid reflux today. Let's address the first question. Is acid reflux, acidity the same? Acid reflux means when the stomach acid comes into the esophagus, that is the food pipe, and that causes a lot of irritation. They are same, acidity and acid reflux are same. Coming to the second, is acid reflux dangerous? Yes, it is dangerous because it can lead to so many other complications. Suppose this acid reflux is not checked, it can also lead to asthma-like symptoms. If acid reflux is not checked, it can lead to ulcer of the food pipe and eventually a cancer, and therefore it is dangerous. Is acid reflux treatable? Of course you can treat acid reflux. Yes. Coming to, is acid reflux a disease? Yes, of course. Acidity leads to some symptoms. First of all, can acidity lead to headache? Well, a lot of patients will say, I have headache first and then there is a vomiting and then I have acidity. So there are people with migraine, they can have acid reflux. People with low between B12, D3 and other enzymes, they can have headaches. So you should take care of it. Let's go to the next. Can acidity lead to chest pain? Of course. If you have a bout of acid reflux, it irritates the food pipe. There is a griping feeling in the food pipe which can mimic a heart attack. And actually, people have been investigated for cardiac problem. In actual fact, they had an acid reflux which caused chest pain. Coming to back pain. Now, back pain will happen when you have a severe inflammation of the stomach because of a bacterial infection, that is H. pylori infection. If there is severe gastritis, they will have back pain. So therefore, we need to be very vigilant if somebody is having pain in the chest as well as in the back. Coming to nausea, can acidity lead to nausea? Yes. Acidity can be related to heartburn? The answer is yes. If there is acid reflux, you will get heartburn. What about heart attack? Now see, this is very important. Patient with chest pain or middle of the chest retrosternal discomfort can be mainly because of acid reflux or early signs of heart attack. So a lot of patients will get unnecessary cardiac evaluation, especially young patients. In fact, they should be going for an endoscopic evaluation for that problem. Looking at pregnancy, yes, heartburn can happen in pregnancy because the reflux of acid, because of the expansion of the uterus when the baby is growing, and if there is obesity, it pushes the stomach and can lead to heartburn. Number 4, can heartburn be a sign of cancer? Oh yes, of course, because those patients who are avoiding symptoms addressal, they can end up with chronic irritation of the lower end of the food pipe, and that can lead to eventually ulcer formation and ultimately end up in cancer, and all this can be diagnosed with a diagnostic upper GI endoscopy. Thank you.